This presentation focuses on thiamine, also known as vitamin B1, and its role in human health, based on the information from NIH Health Professional Fact Sheet as well as other outside sources. Thiamine is essential for three major biochemical pathways. Its active form, thiamine diphosphate, acts as a cofactor for key enzymes involved in cellular metabolism. It plays a central role in glucose metabolism, energy production, and neurotransmitter synthesis. When thiamine is deficient, multiple systems are affected, leading to impaired glucose metabolism, mitochondrial dysfunction, lactic acidosis, reduced DNA synthesis, and disrupted neurotransmitter production. And this diagram here displays all the different pathways thiamine is involved. Because thiamine supports pathways that generate reducing power, its deficiency increases oxidative stress. This can lead to cellular damage, dysfunction, and death. Thiamine is especially important in the nervous system, where it supports neuronal metabolism and protects against oxidative damage. Due to these roles, thiamine has been linked to several conditions, including Wernicke-Korsakoff syndrome, diabetes, heart failure, and Alzheimer's disease. This diagram shows all the different roles that thiamine plays in the body. Wernicke encephalopathy is a serious condition often associated with chronic alcohol use. If untreated, it can progress to Korsakoff syndrome, which causes permanent memory impairment. Mortality rates can reach up about 20%, and up to 80% of patients may develop Korsakoff syndrome. The classic symptoms include eye movement abnormalities, lack of coordination, and confusion, as shown in the picture. Thiamine deficiency leads to significant metabolic disturbances, including reduced levels of alpha-ketoglutarate, acetate, and citrate, along with the accumulation of lactic and pyruvate. Impaired NADPH production weakens antioxidant defenses, increasing oxidative stress. Cellular energy failure disrupts the blood-brain barrier, resulting in cytotoxic and vasogenic edema. Additionally, impaired astrocytic glutamate uptake contributes to excitotoxic neuronal injury, while microglial activation and inflammatory signaling further exacerbate damage. These pathological processes particularly affect metabolically active brain regions such as the mammillary bodies, medial thalami, and paraaqueductal gray matter. Neuroimaging studies, including CT and MRI, commonly reveal symmetrical lesions in these regions, as well as ventricular dilation and mammillary body atrophy. Clinical guidelines emphasize that oral thiamine is often insufficient for high-risk individuals, especially those with chronic alcohol use. In these cases, high-dose intravenous thiamine is recommended, while while oral supplementation is reserved for lower-risk individuals without severe symptoms. Thiamine is transported into cells via thiamine transporters 1 and 2. Once inside the cytoplasm, it is phosphorylated into its active form, TDP. This active cofactor is essential for enzymes involved in glycolysis and the Krebs cycle, including trans-ketolase, pyruvate dehydrogenase, and alpha-ketoglutarate dehydrogenase. Early clinical observations, such as those reported in 1948, demonstrated that thiamine administration reduced glycemia and glycosuria in diabetic patients and decreased insulin requirements. Subsequent research confirmed these findings and highlighted that while TDP itself cannot directly enter the cells, free thiamine can be transported intracellularly and then converted into its active form. This diagram shows thiamine's involvement in those pathways. Thiamine is critical for glucose metabolism, and deficiency is common in people with diabetes. This deficiency worsens hyperglycemia, increases oxidative stress, and promotes the formation of advanced glycation end products, which damage blood vessels and tissues. It also impairs ATP production and cardiovascular function, contributing to complications. This diagram shows the effect of thiamine deficiency. Many individuals with diabetes have low thiamine levels. Some studies suggest that supplementation, including forms like benfotiamine, may improve blood sugar control and reduce complications such as nerve and kidney damage. However, results are inconsistent and more research is needed. Thiamine deficiency can result from poor intake, increased metabolic demand, or conditions like diabetes and alcohol dependence. In heart failure, it contributes to reduced ATP production, leading to changes in vascular resistance and cardiac function. Over time, this can progress from a high output state to heart failure, and in severe cases, cardiovascular collapse. A rare acute form, Shoshenberry, can Shoshenberry can cause rapid cardiogenic shock. Thiamine may serve as a low-cost intervention for cardiovascular health. Some studies show it can improve cardiac function and reduce vascular resistance. Observational data also links a higher thiamine intake with lower risks of hypertension and heart disease, especially in high-risk populations. However, these findings show association, not causation. And this diagram here shows restricted cubic spleen analysis of an association between vitamin B1 intake and heart failure. Thiamine deficiency is relatively common in patients with heart failure. While supplementation may improve heart function in some cases, the overall clinical significance is still unclear and more research is needed. All right. Research also links thiamine status to cognitive function. In a study of 611 non-demented individuals, higher levels of thiamine diphosphate were associated with modestly better performance on the mini mental state examination. Individuals with higher TDP levels demonstrated improved memory, attention, and calculation abilities. Similarly, studies in individuals with mild cognitive impairment have reported lower levels of thiamine and its derivatives compared to healthy controls. This suggests a potential association between reduced thiamine status and early cognitive decline. Animal studies indicate that thiamine deficiency may contribute to Alzheimer's disease through oxidative stress and impaired brain metabolism. Human studies also show reduced activity of thiamine-dependent enzymes. However, there is not enough strong clinical evidence to confirm that thiamine supplementation improves cognitive outcomes. Okay, so to conclude, thiamine is an essential nutrient that functions as a cofactor in key metabolic pathways, particularly those involved in energy production and glucose metabolism. Its active form, thiamine diphosphate, supports critical enzymatic processes, and deficiency disrupts cellular energy production, increases oxidative stress, and impairs neurological function. Thiamine deficiency is most notably associated with Wernicke-Korsakoff syndrome, a serious neurological disorder often linked to chronic alcohol use, but it is also implicated in broader conditions such as diabetes, heart failure, and cognitive decline. In diabetes, low thiamine levels may worsen hyperglycemia, oxidative stress, and vascular complications. In cardiovascular disease, deficiency contributes to impaired cardiac function and altered hemodynamics. Although some studies suggest that thiamine supplementation may improve metabolic, cardiovascular, and neurological outcomes, current evidence is inconsistent. Overall, thiamine plays a critical role in maintaining cellular and systemic health, but further research is needed to confirm its therapeutic potential in chronic diseases. Because thiamine is involved in many different key metabolic pathways, this this particular micronutrient is very interesting in terms of its implications on the human body. And these are my references.